Okay, hey guys. So we're doing chapter 25, trauma overview. There's a lot of stuff in here that is important, um, but at the same time, you can kind of like I always say, make it your own. So kind of remember it the best way you can. Uh, Kinetic energy, potential energy, stuff like that, and we'll get into it. So let's go ahead and get started. So, sorry, trying to get my computer set. Okay. Um, So for introduction here to get going, for people younger than 44, traumatic injuries are the leading causes of death in the United States. Traumatic injuries occur as a result of physical force applied to the body. Medical emergencies occur from like illnesses or conditions not caused by an outside force. So traumatic, we have an outside force affecting the body. Medical, it's an internal problem. Um, The other thing, index suspicion, you're going to hear me say this a lot throughout class. It's also, in my simple mind, common sense is index suspicion. It's use your awareness and concerned potentially serious underlying or unseen injuries. So, for example, we roll up on a car wreck. Index of suspicion is what we use when we look at that vehicle and we're looking for signs of like spider web windshield, dented steering wheels, how far the marks on the road were. Did they hit their brakes? Index suspicion is kind of common sense. We study what we see and we build an idea of what we think happened. So, energy and trauma. So, traumatic injuries occur when the body's tissues are exposed to energy levels beyond their tolerance. And then the mechanism of injury is the way the traumatic injury occurred, describes the force acting on the body that causes injury. Three concepts of the energy is potential, kinetic, and energy of work. Energy can neither be created or destroyed. It can only be converted or transferred. That will probably be a quiz or test question. Um, Work is force acting over a distance. So force that bends, pulls, or compresses tissue beyond its inherited limits results in the work that caused the injury. Kinetic energy, sorry, is the energy of a moving object. So kinetic energy equals half of the mass times the velocity to the second power. Um, I don't know the exact numbers, so don't like quote me on this, but it's like if we're running 60 mile an hour and we hit a tree, our airbag and us impact at 120 miles an hour. Um, let's see, potential energy is the product of mass, force of gravity, and height, mostly associated with the energy of falling objects. Like I said when we first started, read your chapter, break this down to where you understand it. Um, it's not something that we use it every day. We just don't realize it. We don't put it into these terms, I guess is what I'm trying to say. Mechanism of injury profile. So determine the mechanism of injury, or MOI, produced many types of injuries that produce many types of injuries. The non-significant ones are things like falls to an isolated body part or falls without loss of consciousness. With that being said, um, they don't always lose consciousness and you can still have an injury and it can be significant. But what it's saying here is if it's a fall with, a broken arm, that's not considered a life threat. They didn't lose consciousness. There's not altered anything like that. So as we do our assessments, which that's why assessments are so important, single body system, non-life threat is considered non-significant. So significant injuries, so injuries to more than one body system, which is a multi-system trauma, falls from a height. or from heights, motor vehicle or motorcycle crashes, car versus pedestrians or bicycle, gunshot wounds, and stabbings. And we're going to break all these down as we go through these slides. Um, but those are all considered significant injuries because, especially if there's multi-system trauma, these can be life-threatening. Blunt and penetrating trauma. So blunt trauma is a result of force to the body that causes injury without penetrating the soft tissue. I think we can all figure that out. Um, this will be a fall. This will be, someone got hit with a baseball bat. It was a blunt trauma. Penetrating trauma, of course, is when the object pierces or penetrates the surface of the body. It's a penetrating trauma. Either type may occur from a variety of mechanisms of injury. Blunt trauma results from an object making contact with the body. Motor vehicle crashes and falls are the most common mechanisms of injury. Be alert for skin discoloration and pain. Maintain a high index of suspicion for hidden injuries. That's why I preach so hard on doing our skill sheets and running the entire assessment, because a simple fall can actually be a massive thing if we bumped our head and there's a small brain bleed, or a car wreck that doesn't look that bad, but we have a slight internal bleed. These are the things we need to pay attention to during those assessments. Vehicle crashes. So a crash consists of three collisions: the car against another car, tree, or object. By assessing the vehicle, you can often determine the mechanism of injury. Use some common sense. Index of suspicion here. So passenger against the interior of the car. We'll back up. The first one is car versus an object, whether it's a tree, another vehicle, whatever. So, and it doesn't have to be a car wreck, but it's car versus an object, and then it is us impacting the car, and then it is our interior, our brains, our organs contacting our interior. So we our solid structure of our body is how it's worded in here. So car hits something, we hit the car, and then our organs hit the inside of us. Those are your three impact points. Vehicle crashes, significant mechanism of injury include the following: death of an occupant in the car. So let's say that the passenger was killed, but the driver says they're fine. That's a huge index of suspicion. If it was bad enough to kill someone else in that vehicle, then the person who survived definitely needs checked out. We need to do our full assessment and pay close attention to them. That is a significant mechanism of injury. Severe deformity of the vehicle or intrusion into the vehicle. Little common sense. How bad's that car tore up? And how far dented is it? Intrusion is inward. How far inward is that car damaged? Severe damage to the rear. We're going to look at whiplash, crashes in which rotation is involved, always high suspicion, and then ejection from the vehicle, of course, is not going to be a good thing. Evaluate supplemental restraint systems. So determine whether the passenger was restrained or whether the airbag deployed. Something we just have to get in the habit of asking on car wrecks. Did you have your seatbelt on? One of the first things I look at when I roll up to a motor vehicle accident is I look at the windshield for spider webbing. I look at the steering wheel for denting. I ask them, was you wearing your seatbelt? And then I also try to look in there, like under the dashboard, and see if all that's broke loose or loose, because it could identify lower extremity, pelvis, and hip injuries. Airbags decrease the severity of deceleration injuries and decrease injuries to the chest, face, and head. We know what airbags do. Despite airbags, suspect injuries to the extremities resulting from a second collision, and internal organs resulting from the third collision. So just because there's an airbag and they have their seatbelt on doesn't mean that they're not going to be injured. Children shorter than 4'9" should ride in the rear seat. Remember that if an airbag did not inflate during the accident, it may deploy during extrication. Firefighters will show up. They usually will cut the battery cable. They will disable that airbag um, because we don't want to go crawling around there and it go off and it pop us. And there are a lot of times in vehicle wrecks where we get in the vehicle and we work on that patient inside that vehicle. So we just need to make sure it's seen safe. That's part of it right there. Uh, if you have ever seen Final Destination, like 2 or 3, airbag goes off and kills a woman, that's actually pretty possible. It's not far-fetched. Remember that supplement restraint system can cause harm whether they are used properly or improperly. So this is something else that you really need to check during your assessment. The person might be saying they're fine, they're good, they're good. Did you have your seatbelt on? Yes. Go ahead and check their chest area because that can affect our respiratory. We can have internal bleeding. Like this picture shows, that abrasion, that's pretty normal. You're going to get a really bad abrasion, or you can get bruising along that area. You can have bruising to the face along with swelling due to the airbag. Are those life threats? Absolutely not, but it can indicate something internal. So we got to keep an eye on that. Frontal crashes, look for the contact points between the patient and the vehicle as you perform a simple, quick evaluation of the interior of the vehicle. That's kind of what I was saying earlier. One of the first things I do as we pull up on scene is I'm looking at the windshield. I walk up there, I check airbag, steering wheel, and lower dashboard. Rear crashes, we got to pay attention to whiplash, particularly in absence of a headrest. Whiplash is as the body is propelled forward, the head and neck are left behind. Acceleration type injury to the brain is very possible with these. Side impacts, very common cause of death associated with motor vehicle crashes. A vehicle struck from the side is usually struck above the center of gravity. It begins to rock away from the side of the impact. Results in the passenger sustaining a lateral whiplash injury, so that head goes sideways instead of forward and backwards. They're going to be complaining of neck pain. We've got to hold C-spine, put C-collar on backboard, head blocks, the whole 9 yards on that one. If there's intrusion to the vehicle, into the passenger compartment, suspect lateral chest and abdominal injuries on the side of impact. Possible fractures to lower extremities, pelvis, and ribs, organ damage on the third collision. So pretty much this is index suspicion. We look, okay, that car got hit on the driver's side, intrusions more than 8 to 12 inches. I'm immediately going to start thinking internal problems. Externally, might have some redness, bruising. I mean, worst case scenario, yeah, they're cut up and it's all bad. But if nothing on the outside is visible, I'm still very suspicious of internal issues. Rollover crashes, so large trucks and sports utility vehicles are prone to rollovers. Injuries depend on whether the passenger was restrained. Most common life-threatening event is ejection or partial ejection of the passenger from the vehicle. Rotational crashes, so spins are conceptually similar in rollovers. Rotation of the vehicle provides opportunities for the vehicle to strike objects such as utility poles. Yeah. Car versus pedestrian injuries often graphic and unapparent, or apparent, sorry. Can also be serious unseen injuries. You should determine speed of the vehicle, whether the patient was thrown through the air, surface the patient landed on, and whether the patient was struck and pulled under the vehicle. I don't know if it goes into it. I will jump ahead probably, but size of the patient versus size of the vehicle plays a huge role in this, because if a little kid gets hit by my pickup, then we're looking at upper body injuries. But if a full-grown adult, say 6 foot tall, got hit by my pickup, then I'm going to be looking at hip and trunk, and lower extremity injuries. So this height of the patient versus the vehicle, we got to pay attention to that. So check for structural damage of the vehicle. ALS backup should be summoned for any patient who has sustained a significant mechanism of injury. We can get on the scene and start pushing fluids and meds as needed. Car versus bicycle, evaluate like you would for a car versus pedestrian. Evaluate the damage to the position of the bike. If the patient was wearing a helmet, inspect it for damage. It can kind of give us a little bit of information. Once again, yeah, we're looking at the bike, but what's the height of all that compared to the vehicle? A little sports car, lower extremities probably going to be damaged. Pickup, we're going to be looking at midsection, right? Presume that the patient has sustained an injury to the spinal cord or column or spinal cord, sorry, until proven otherwise at the hospital. Spinal stabilization must be initiated and maintained during the encounter, which we're going to learn all this in class, but we once we hold C-spine, we don't let go until we have those head blocks on a backboard. Car versus motorcycle. Protection is from a helmet, leather or abrasion-resistant clothing, and boots. When assessing the scene, look for deformities of the motorcycle, side of the most damage, distance of skids in the road, deformities, and stationary objects or other vehicles. Um, extent and location of deformities in the helmet. If they're wearing all their protective gear, that's awesome. A lot of them don't. So we've got to do full body assessment on these. Remember, this is all traumatic, so they're going to be trauma naked anyway. So we need to see and touch everything. Head-on crash, motorcycle strikes other objects and stops its forward motion while the rider continues to move forward. Angular crash, motorcycle strikes an object at an angle so that the rider sustains direct crushing injuries to the lower extremities. Ejection, rider will travel at a high speed until stopped by stationary object, other vehicle, or road drag. Sorry. Controlled crash, technique used to separate the rider from the body of the motorcycle. Falls, injuries potential depends on the height from which patient fell. More than 20 feet is considered significant. Internal injuries pose the greatest life threats. Patients who fall and land on their feet may have less severe internal injuries. Their legs may have absorbed much of the injury during the fall. So what this picture here is showing, yeah, we fall and we land on our feet. That energy is going to transport up our body. So we're going to be looking at hip and pelvis. I mean, the full lower extremity, definitely, but we really need to pay attention to that pelvic and hip area on these significant falls where they land on their feet. Take the following factors into account: the height of the fall, the type of surface struck, and parts of the body that hit first, followed by the path of energy displaced. I've been on a ton of falls that turned out to be pretty significant calls, and I don't think I've ever had one over 12 feet. I've had pneumothorax, so collapsed lungs. I've had broken legs, broken hips, arms. It all depends on where that person lands. And you also take into account when someone falls, their body height. So if I have a fall of you're standing on a ladder that's 4 foot tall, and I fall, I'm close to 6 foot, so I'm automatically going to take 4 + 6, and that's my total height of fall. So height of where they're at plus their heights is kind of what we figure. So now we're going to move on to penetrating trauma. Second leading cause of trauma, death after blunt trauma, accidentally or impalement, or accidentally by impalement. Internally by a knife, ice pick, or other weapon. Seen a few of those too. With low energy Penetrations, injuries are caused by a sharp edge of the object moving through the body. Knives have been deliberately moved around internally, causing more damage than the external wounds suggest. So we don't know what's taking place underneath that knife inside the body, so we always assume the worst. Um, that's why knowing a little bit of anatomy goes a long ways because we can go, okay, that knife's in the right side of the chest. I know we probably missed our heart, but hey, we probably got a lung. Or if it's in our lower or it's in our abdomen, we can kind of guess, what organs it might have struck. Um, Penetrating trauma again, path of projectile may not be easy to predict. Bullets may ricochet within the body before exiting. Path of the projectile takes its trajectory. Fragmentation will increase damage. Most people do understand how a bullet works. If you don't, as it enters, the force around it will cause tissue and muscle to expand. Um, which is fixing to be a picture of that. It's called cavitation. If that bullet fragments, which most of them will, it breaks off into several pieces, just destroying everything in its path. So on gunshots, we have to be very cautious. So cavitation results from rapid changes in tissue and fluid pressure that occur with the passing of a projectile, can result in serious injuries to internal organs. That's exactly right. Um, Entrance wound can be tiny. Exit wound is usually a lot larger than the entry wound. Um, we have got to stop the bleeding, of course, and we'll get into that in class. Um, Penetrating trauma relationship between distance and severity of the injury varies depending on the type of weapon involved. So, air resistance or drag slows projectiles. So that's saying, especially with like a gunshot, the further away that shot is, yes, it's still a gunshot, but the power is less the further away we get. Areas damaged by projectiles is typically larger than diameter of the projectile. Energy available for the bullet to cause damage is more a function of its speed than its mass, which is what we were just talking about a second ago. Um, Most common in military conflict, also seen in mines. Oh, sorry, we're on blast injuries. Sorry, my daughter was texting me and I'm trying to talk and answer her. Give me 1 second, please. Yeah, go ahead and take whatever you need. Sorry. I'm in Cherokee right now. My daughter's asking if she can go fishing. Um, so blast injury is most common in military conflict, also seen in mines, shipyards, chemical plants, terrorist attacks. So we're going to go into blast injuries. We're going to go into all this later on in the book where we have a like chest trauma chapter where we'll go more into detail on like penetrating and stuff. So blast injuries will have another chapter. So we're going to move through this pretty quick. Um, there's different phases of that blast injury, primary, secondary, and I never can say it, territorial blast injuries. So primary blast injuries due entirely to the blast itself. It damage to the body by pressure wave. So it's that initial pressure wave that comes off. The secondary blast injury, damage to the body results from being struck by flying debris. So the shock wave has hit us, and now there's debris blowing. And then that last one, territorial blast injuries, is victim is hurled by the force of the explosion. So shockwave, debris, and then we're flying. Um, let's see, blast injury. So we got to worry about burns from hot gases or fire started by the blast, respiratory injuries from inhaling toxic gases, crush injuries from the collapse of buildings. Most patients will have some combination of the four types of injuries. Hopefully, we don't ever have to deal with that. Organs that contain air are most susceptible to pressure changes. So these blast injuries can cause internal problems to the middle ear, the lungs, and the gastrointestinal tract. The ear is the most sensitive to blast injuries. Pulmonary blast injuries, so our lungs result from short-range exposure to the detonation of explosives. Arterial air embolisms can produce disturbances in vision, changes in behavior, and the state of consciousness, a variety of other neurological signs. Still on blast injuries, so solid organs are relatively protected from the shock injury. Neurological injuries and head trauma are the most common cause of injuries. Traumatic amputations are common. Um, I kind of think a lot of this is common sense. If you just kind of imagine that you were standing next to an explosion. Multi-system traumas, so it involves more than one body system. Head and spinal trauma, chest and abdominal trauma, chest and multi-extremity trauma. Uh, Alert medical control and transport rapidly. Patients have a high level of morbidity and mortality. So, a lot of your car wrecks, a lot of falls, will be a multi-system. If it affects more than one thing, it's a multi-system. Uh, your main priority is to ensure your safety, safety of your crew, safety of the patient. Determine the needs for additional personal equipment. Um, Evaluate the mechanism of injury. So BSI might seem safe if you haven't heard that enough yet. Um, and then let's use some common sense. Let's study that scene before we go running in. Identify and manage life threats. Uh, then focus on patient care. Hemorrhage, airway and ventilation support, shock, spinal immobilization, transport immediately to appropriate facility. Right there is our almost our full assessment, really. Um, BSI seems safe. Do I need additional help? We're going to hold C-spine. Is there any life threats that I need to fix right now? We can do that the rest of that on the go if we have to, right? We can do our hands-on. We can do our secondary, um, depending on the call. Definitive care requires surgical intervention. On-scene time should be limited to 10 minutes or less with trauma. And as we learn our skills, yes, when you test out, they are timed. Trauma, you have 10 minutes. Medical, you have 15. We should be able to do everything in under 10 minutes. Obtain that sample history and complete your secondary assessment. Consider ALS intercept or air medical transportation. Your primary assessment when a patient is experiencing a significant mechanism of injury and is critical condition, rapidly perform a physical examination. When the patient has experienced a non-significant mechanism of injury, focus on the chief complaint. Um, Injuries to the head. Disability and unseen injuries to the brain may occur. Bleeding and swelling inside the skull is often life-threatening. Include frequent neurological examination to your assessment. And then some patients will not have obvious signs and symptoms. And we will go over this in detail in class when we do our skills. Um, we'll have scenarios where the patient starts out fine and you can watch them deteriorate. Um, Something I want to throw out there with head traumas is sometimes a small brain bleed can take days or weeks to actually have signs and symptoms. So anytime we have a significant head trauma, although it doesn't seem significant, if it's head trauma, we need to pay close attention to that. Injuries to the neck and throat. Areas of serious and deadly injuries, airway problems may result. Look for that DCAP BTLS in the neck region. Swelling may prevent blood flow to the brain. Once again, depending on what the call is, and your mechanism of injury, your index of suspicion, it should kind of guide you in the right direction. Penetrating injuries may result in air embolisms. The crushing injury may cause the cartilages of the airway, upper airway and larynx to fracture. Uh, those cartilages keep our airway open. So when they are fractured or altered in any way, it can actually cause a collapse of the airway. Injuries to the chest. Chest contains heart, lungs, and large blood vessels. Many life-threatening injuries may occur. So we've got broken ribs may hinder breathing. Heart may be bruised. Large vessels may be torn. Injuries to the chest, like I said, there's a whole separate chapter on this later that we're going to do. A penetration or perforation of the integrity of the chest is called an open chest wound. If untreated, shock and or death will result. Assess the chest region every 5 minutes. Assessment should include that decap BTLS, lung sounds, and chest rise and fall. Yes, the book teaches you 5 minutes. What I was taught was when you are done assessing, you reassess. So when you get done with your assessment, start it all over again. Um, you have nothing better to do in that truck. Injuries to the abdomen. Abdomen contains vital organs that require a very high amount of blood flow. Solid organs include the liver, spleen, pancreas, and kidney. Go ahead and learn these because you're going to get lots of test and quiz questions on hollow organs versus solid organs. Hollow organs include the stomach, large and small intestines, and urinary bladder. Solid organs may tear, lacerate, or fracture. Hollow organs may rupture and leak toxic digestive chemicals into our body. The rupture of large blood vessels can cause serious unseen bleeding, which we're going to see signs of shock. We're going to see blood pressure drop. We're going to see respiratory rate go up. Scene time. So survival of critical injured trauma patients is time dependent. Limit on scene time to less than 10 minutes. Critically injured patients, dangerous mechanism of injuries, decreased level of consciousness, threats to airway, breathing, or circulation. ABCs all day long. Those are your life threats right there. Destination selection level 1 facilities. Serves large cities and heavily populated areas, provides every aspect of trauma care, usually university-based hospitals. Trauma 1. Trauma 2 or level 2, located in less populated, dense areas, provides initial definitive care. Level 3 facilities provide assessment, resuscitation, emergency care, and stabilization, transfer patient to level 1 or 2 facilities when necessary. Then you've got your level 4, found in remote outlying areas, provides advanced trauma life support. Let's see. AAMS and Med Evac Foundation International identifies critical and emergency air medical services for trauma patients. Extended period requires to access or extricate a remote or trapped patient. Patient needs ALS care and no ALS level ground ambulance services available. Multiple patients, trauma patients, mass casualty incident. So when is it okay to call air? Pretty much. Know your local protocols, which I think I've probably said before, but on these critical patients, can air get there, get the patient, get them to the hospital faster than you can? That's kind of the golden way to look at that. Is ALS available? So that can be an advanced EMT or that can be a paramedic. Are they available? And once again, can they get to that patient and transport them before air can? Trauma centers are categorized as either adult trauma centers or pediatric trauma centers. Do not transport a pediatric patient to an adult trauma center when a pediatric trauma center is available. Pediatric trauma centers specialize in pediatrics, obviously, because pediatric trauma and adult trauma is two different ballgames. Type of transport, we've got ground EMS units. They're staffed by EMTs all the way through paramedics. Air EMS units and critical care transport units are staffed by critical care nurses and paramedics. This is an example here of a transport protocol. It's yes and no. Is your patient alert And are they breathing? Yes. You follow the arrow down and see what's next. No, you follow the no arrow and see what's next. That's how you read a protocol. Special considerations. Remain calm. Complete and organized assessment. Correct life-threatening injuries. Do no harm and never hesitate to contact ALS backup or medical control for guidance. As you guys get into this and you're out there in the real world running calls, there are going to be times when you come across a patient, and if at any point you go, I don't know what to do, call that medical control, call for ALS backup. There's nothing wrong with that. Don't let your ego affect someone's chance to live or die. So I think we're fixing to start our review. There we go. Kinetic energy is a calculation of. I believe it is B, weight and speed. There we go. All right, moving on. A 20-year-old man has major open facial injuries after his vehicle struck a tree head on. Which of the following findings in the car would most likely explain his injury pattern? A deployed airbag, bent steering wheel, a non-intact windshield, or crushed instrument panel? Well, that's not a very fair question. We're going to go with C, a non-intact windshield. Ben's we're dealing with the face. It probably came up and struck the windshield. If it was a chest injury, I would say steering wheel. If it was a lower extremity, I would say it was the underside of the steering wheel or dash. So C. Which of the following would most likely result from the third collision in the three collision effects that occur during a high-speed frontal impact motor vehicle crash? So what would happen in that third collision? We're going to go with D, the aortic rupture or compression injury to the brain. That is that internal force. Um, car hit the tree, hit another car. That's one. We hit the inside of the car. That's two, and then our internal organs hit our internal body. That's three. A young male experiences severe blunt chest trauma when his passenger car struck another vehicle head on. During your inspection of the interior of the vehicle, you should most likely find. I kind of gave you guys the answer to this one a second ago. It's going to be B. It's that steering wheel deformity. An unrestrained driver collides with the bridge pillar. Upon inspection of the interior of the vehicle, you note that the lower dashboard is crushed. During your assessment of the patient, you will most likely encounter. Kind of gave you the answer to that one too. It's going to be A. It's going to be that trauma to the pelvis. Whiplash injuries are most common following blank impacts. A, the rear end impact. Death from a roller motor vehicle crash is most often secondary to. Most often it is going to be D, ejection of the patient from the vehicle. Severe abrasions occur or injuries can occur when motorcycle riders are slowed after a collision by the road drag. Road drag is most often associated with the type of motorcycle impact. It's going to be C, ejection. um, when they get thrown off of it and they just skid down the road. When assessing a stab wound, it is important for the EMT to remember that yeah, remember, we don't know what's going on inside the body, so more internal damage may be present than the external wound suggests. So D. We got one more here. A 40-year-old man was standing near a building when it exploded. He has multiple injuries, including depressed skull fracture, severe burns, and an impaled object in his abdomen. His head injury was most likely caused by blank blast injuries. Remember the one I couldn't say? So it is C. Guys, we have survived that chapter. Thank you. If you have questions, reach out to me. I'll do my best to help you, and I'll catch you on the next one.